sorry.
Okay, that's all. That's fine. December 1st was the next appointment, correct? And you can look at the interval history.
Yes.
Now, on that December 1st appointment, this is after she had transferred to South Shore.
Yes.
She disclosed to you that she had been seeing South Shore, right?
Yes.
We already talked about the fact that you never got the records from South Shore, so you don't know, other than what Lindsay reported to you, what medications she was on, right?
Right. I knew what she was telling me.
Right, and she told you that she was doing the Ativan taper, right?
Well, she said she had tried doing that, but that then she was having worse sleep.
Having difficulty sleeping is what she indicated to you, right?
Yes.
And she tried other meds that you had suggested, but stated that she was having difficulty with those meds, including Trazodone, right?
Well, the Trazodone she didn't have a problem with. It just didn't seem like it was particularly helpful.
Right. Did you prescribe the Trazodone or somebody else?
This was somebody else.
So do you know what the milligrams were that she was on?
It says she tried between 50 and 150 milligrams.
All right. Now, did she at some point try Remeron?
She said that she did.
Did you suggest in your discussions that she try Remeron?
No, I did not.
Did she indicate to you that she had rebound anxiety and intrusive thoughts, that she was going to die? Do you recall that?
Well, she said worse depression and intrusive thoughts.
Okay. Did she tell you what the intrusive thoughts were?
It was the feeling like I'm going to die.
Did she then have a script for Prozac, 10 milligrams?
That's what she said.
And she said that she couldn't sleep and had worse sleep, so that had to be stopped, right?
Yes.
Then she was on Klonopin, right?
Yes.
And what is Klonopin?
It's a benzodiazepine.
And on December 1st is when she told you, again, that she was close to having suicidal ideation, feeling hopeless. Do you recall that?
Yes.
Now, on the interval history, on that date, you indicated that she can't sleep, she's panicking, she had worse depression, intrusive thoughts, she was numb, nothing mattered, I feel like I'm going to die, denies suicidal ideation, but, quote, yesterday, close to it, feeling hopeless. Did you give her therapy and validations after she told you that?
I believe that I did.
What did you do? You got a woman that's telling you that she's hopeless. She doesn't care if she dies. Can't sleep. What did you do to validate on your therapy?
Well, I told her that this was something that we could address, that there was hope, that there were treatments, and there are different types of treatment programs that are more supportive, like partial hospitalization programs. So she knew that she still had options and a reason to hope.
Did you ever suggest to her that maybe you ought to come in to see me rather than talk on the computer?
Talking with her over the video did not seem like an issue. It didn't seem like there was anything that I was missing or that there was any need to see her in person.
Now, you'd agree with me that in December of 2022, COVID was all done, right?
It wasn't completely all done.
Were you still nervous about dealing with people and wearing masks and stuff, or were you able to sit down and talk to somebody face to face?
We were definitely feeling more comfortable about being face to face with people, but I think, it was still something that we thought about.
You discussed trying Seroquel with her at that point, right?
I didn't really discuss it. Well, she had told me that was something that she had discussed with her other provider.
So looking at your notes, does it say also discussed trying Seroquel alone tonight? Your notes say that?
It says yes, but I wasn't making a recommendation about the Seroquel. It was just a medicine I was providing her more information on.
So you were telling her about the Seroquel? You're providing information?
Yes, we were talking about the Seroquel
Right. Why?
because her other provider had recommended that she started it.
What is Seroquel?
It's an antipsychotic.
You also discussed with her the possibility of undiagnosed bipolar disorder, did you not?
It was discussed.
And undiagnosed bipolar disorder was, in your opinion, as a result of not a reaction, but extreme reaction to the SSRIs, right?
Not as a result of the SSRIs, but that
Does your note say, and I quote, also discussed possibility of undiagnosed bipolar disorder given extreme reaction to SSRIs and insomnia, period. Does it say that?
Yes.
Those are your notes, right?
Yes, the way you were saying it made it sound a little bit different before, but that's exactly what I wrote.
I read it directly from your note, right? How did I make it sound different?
I don't know. It sounded different the first time you said it than the second.
So did she have bipolar?
No.
Did you make that decision that night? That day?
I assessed that with her pretty much every time that I saw her, and she never had mania.
What about mood stabilizer like Lamictal? Did you discuss that with her?
Yes.
What is Lamictal?
It's an anticonvulsant, but it's used in treating mood disorders.
So what was the end result of your meeting with her on December 1st? What did you guys do? Did you give any recommendations, advice, anything?
Yeah, well, so at this time, I was not prescribing her medications, but I was still concerned, not concerned enough that she was at imminent risk of hurting herself or anybody else, given what she said. But we had a plan for her to pursue a partial hospitalization program.
Where was that?
Well, the one that I had recommended was HRI.
What is that, HRI?
It's a hospital in Brookline.
And did she ultimately go to another hospital?
She ultimately went to the Women and Infants Hospital for one day.
And those are the records that you didn't get, right?
Correct.
Okay. And you decided that she did not have bipolar disorder because, in your opinion, she did not meet, and I quote, the criteria, right? And that would be the criteria in the DSM, right?
Yes.
And the DSM, of course, is the Diagnostic Statistical Manual, Roman numeral 5, meaning text revision, right?
Yes.
Is that what you were using back then? Would be this thing here, DSM-5, TR? That's the DSM, right? It's like a cookbook, right?
It's more of a guideline that we use to, to help us in our treatment, but it's not the psychiatry Bible that people sometimes think that it is.
Right. Hypomanic bipolar disorder. How many days does that require under the DSM?
A hypomanic episode lasts for at least 4 days.
And is that per the DSM?
Yes.
Remember on Friday you said that the most important criteria is 7 days with continued high energy levels?
Yes.
So is it 7 days or is it 4 days? And who says?
Well, mania is 7 days. Hypomania is 4.
Discussed again with her on December 1st, and that would be the Lamont sheet, right?
Yes.
And you know in your your records that she indicated that she was really struggling. And it was as a result of that that you recommended that hospital referral, correct?
Yes.
You agree that she had, in your opinion, a severe mental disturbance at that point that was manifesting itself?
She had a maybe moderate heading towards severe.
Moderate heading towards severe mental issue, okay. You'd agree with me that she had increased anxiety, right?
Yes.
She had very, very increased depression, right?
Well, she did. She said
Okay, so as you
since the
answer this,
Ramadan.
just answer yes or no.
I'm sorry, I was just trying to check the record.
Okay, you can check the record all you want, but if I ask you a question respectfully, can you just not go on and ramble? Answer yes or no, that's all.
It's sometimes impossible to do that.
Oh,
There's
right.
Listen, here, if you can't answer yes or no, just say you can't answer yes or no. If you can answer yes or no, answer a yes or no. That's how we do it, all right?
okay.
Thank you. Now, mental issues like anxiety that was diagnosed, the depression that was diagnosed, and the fact that she indicated yet again that she was close to suicidal ideation, quote, worried about suicidal thoughts, but you indicated that she wasn't suffering from suicidal ideation on that day. Is that fair?
She denied it.
But she told you that she was worried about suicidal ideation and having suicidal thoughts, right?
Well, this was the time she said she was worried that she was close to having suicidal thoughts.
So did you ask her what does that mean? Does that mean that she's standing at the edge of the stairs and she's thinking about falling down the stairs or what? What does that mean? I'm close to suicidal ideation.
So I asked about that, and that's when she said she described it further as using the word hopeless.
So did you prescribe the lamotrigine on that occasion or no?
No.
On December 16th, that's the next appointment she had, right?
Yes.
That'd be 2 weeks later? Right?
Yes.
She was still not well, correct? She told you she was having a really rough time.
She was sleeping, but she was still feeling very poorly.
In your notes, does it say that she was having a really rough time?
Yes.
So when I asked you, if your notes reflected that she said she was having a really rough time, why do you feel compelled to say she was sleeping?
Objection.
Overruled.
It's an important detail.
Yeah, I guess. How about the rough time? What did that mean? What were the symptoms of having a really rough time for this kid?
Do you want me to?
Yeah, I'd like you to answer that.
So finally works, referring to the Valium and quetiapine, but very depressed during the day. No motivation, some SI. Do you want me to continue?
Sure.
Went to MGH emergency room for SI, declined inpatient, feeling hopeless, no intent or plan, and feels like depression related to Seroquel.
Okay. Now that's the question on Friday that, well, strike that. So what was the SI, suicidal ideation?
Yes.
And can you read that back to me again? What did she say about SI?
So that when she went to the hospital, she went because she had no motivation, some SI.
Some SI meaning that she had some suicidal ideation, right?
Yes,
Yes?
in her words, yes.
Yeah, in her words. As opposed to thinking about having suicidal ideation or worrying about suicidal ideation. She actually indicated that she had suicidal ideation, right?
I can't answer that as a yes or no.
Well, it's in your notes that she said that, right? Yes?
What is in my note?
Do you understand my question?
I'm a little bit confused right now. Can you repeat what your question is?
Sure, of course. We spent some time talking about thinking about suicidal ideation, worrying about suicidal ideation.